As I said earlier, myocarditis is an inflammation of the heart muscle that we call, the heart layer that we call myocardium. The myocardium heart layer, that is inflammation. That's why it is called myocarditis. And in a case, in a disease that you see, inamalizia eyes, myocarditis, peritonitis, bronchitis, that is it means it's an inflammation of the heart, of the muscle involved. So for this one, this is a myo actually means heart, or the heart muscle. Then eyes, that is inflammation of the heart muscle, the inflammation of the myocardium layer of the heart. So the causes could be environmental, can be autoimmune, can be viruses, and such like things. So the symptoms include, I'm talking about this because I've seen this patient. I've come across this patient today at night, and yeah, the patient was presenting with all of these symptoms that I'll highlight here. So first of all, shortness of breath. Yeah, the shortness of breath, this chest pain, edema is there. Edema is the inflammation, not inflammation, but ni kufura miguu, kufura miguu, mikono, the extremities, the hands, legs. That tells you the heart is not functioning as it should be, and that is abnormal. No one should tell you that it is normal when your legs imefura, wakati mikono yako imefura. That tells you that mostly you have a heart issue. Yeah, kufura sio kawaida. Sio kawaida. Yeah. So there's also irregular heartbeats, yeah, lightheadedness, kuumwa na kichwa, anaumwa na kichwa but si ile serious sana, and then that lightheadedness, kusikia ni kama kizunguzungu, like yeah. It's because all the fluid zimeenda towards the extremities, miguu, mikono, so the body has not enough fluids going through. When I talk about fluid, I'm talking about blood. Yeah. So this management of this patient. First of all, this patient lazima apewe bed rest. Yeah. That's the very first thing that you do to the patient. Also for the diet, you got to advise the patient not to take, as in the patient should take a low salt diet. Yeah, because of sodium and such like. Yes, so the patient needs to rest. The patient needs to have that bed rest. That patient. Yeah. Also, we use defibrillators. We can also, the patient can also be put, pacemakers can be installed to help the heart beat well or beat normally. Yeah. So the treatment from the medications, you can give corticosteroids. Yeah, these are medications. You also give IV immunoglobulins. We give that also. Yeah. This one, we rarely use antibiotics unless the patient has some other signs of infection. Yeah. Otherwise, we just do beta blockers. We do corticosteroids. Yeah, these are anti-inflammatory agents. Yeah, IV immunoglobulins, also ACE inhibitors we do give. Yeah, the patient can also have a heart transplant. Yeah. That's it. Yeah, so that's it for now. Nifunge kazi. Nikafunge. Any other question? Let me know.